All right, so it turns out that we can make our own semaglutide and Ozempic in our own gut. We always have. And as we age and as our gut becomes more dysfunctional as the years go by, we end up not making these peptides like we should. But this particular paper was released in December of 2023 that shows the brain immune axis that controls inflammation is affected by GLP-1 peptide that we should be making in our gut. These findings were published in Cell Metabolism and showed that these GLP-1 receptor agonists are not only highly effective for weight loss, but reduced inflammation and having a significant impact on chronic metabolic disease. So these GLP-1 receptors are abundant in the brain, and the brain and immune system communicate with all organs. So without the brain functioning, then we can't reduce inflammation, we can't have great insulin sensitivity. We end up gaining weight and inflammation accumulates. So they studied this by creating systemic inflammation and ultimately inducing sepsis, like bacterial infection in the blood type sepsis. And it created extensive organ damage in these rats that they studied. And so remarkably, GLP-1 agonists reduce the inflammation and help to save some of the tissue. And so it's the first time that they've shown that GLP-1 brain immune axis controls the inflammation independent of weight loss. And so those scenarios where we have improvements in many areas of semaglutide treatment, not only weight loss, but reducing chronic cardiovascular issues, improving cholesterol, helping the liver, helping the pancreas and insulin sensitivity overall. We find that insulin resistance is a key critical player in brain function as well. So not only do Alzheimer's patients show reduced glucose uptake due to insulin resistance in the brain, but also folks who are pre-diabetic and early type 2 diabetics also have been found to recall less items on a memory task and have disordered metabolism in the brain. So not only is losing weight something that helps us to look good and feel good here in the new year, but it's also critical to understand that gut bacteria help us with this insulin sensitivity by making GLP-1 peptides and how it's involved in brain signaling. So we do know for sure that there's one bacteria that is about 5% of the commensal or good bacteria within the gut, help to stabilize the microbiome and the gut barrier integrity. And so this one particular bacteria is called Akkermansia muciniphila. And Akkermansia has been associated with neurological disorders throughout the spectrum of neurological disorders because inflammation on nerves in the gut ultimately ends up creating inflammation on nerves in the brain. And so Akkermansia also has been found to be associated with good insulin sensitivity, improving weight loss, reducing appetite, and helping you to lose weight. And the reason that it does that is because one study found that it certainly helps to improve GLP-1 production within the gut. And so it's making semaglutide and Ozempic for you in your gut, and you don't have to have a prescription. And ultimately, we get the benefits of all of that by making sure that our gut bacteria are in good order. So here we have a slide from a stool test, a GI spotlight test. I was reviewing a patient's results this morning and found that this person had low Akkermansia muciniphila and Prosnitzi. This Ficobacterium prosnitzi was also low. That particular bacteria is associated with chronic immune problems within the gut. And we also see the reason why that might be. Zonulin there at the bottom is a marker for gut barrier integrity. And if we have high zonulin, then we also have a leaky gut. And so with a leaky gut, we've got major problems. The other high marker there is Firmicutes. So Firmicutes and Bacteroides are the commensal bacteria that make up the majority of our gut. We need them to be in good order, but we don't need them to be increasing their numbers in spite of or in compensation for low Akkermansia and Prosnitzi. So more about Akkermansia mucinophilia. Mucinophilia plays a role in modulating glucose tolerance, energy metabolism, and the maturation and function of the immune system. And it impacts conditions like folks that are overweight, diabetes and obesity, hypertension, colitis, and age-related complications. So it's an anti-aging bacteria and reduces chronic disease. It's associated with contributing to the restoration of the gut microbiota, maintenance of the mucosal barrier, and gut immunity, which limits the onset of inflammation. It's also been found to increase the thickness of the colonic mucus layer, the mucosal lining of the gut that protects the gut barrier, increases it by nearly threefold, which is just unbelievable. So we see this Akkermansia restoring the gut microbiota and maintaining good gut barrier function because it is a mucin loving. So that's what mucinophilia means in Latin, is mucus loving. So it produces mucus, it feeds on mucus, it increases its numbers by having mucilaginous foods in our diet. I'll tell you a little more about that in a moment. But the big surprise is that Akkermansia also basically increases the amount of this one particular glycerol that stimulates the production of glucagon-like peptide, which is unbelievable that this one bacteria has been associated with increasing that peptide. I would imagine that all good bacteria in the gut contribute to the making of glucagon-like peptide, just like many other peptides that our good gut bacteria make. And so, of course, this GLP-1 is associated with appetite suppression, anti-diabetes properties, and weight loss. One way that we increase mucilaginous contribution to feed our Akkermansia is with mucilaginous foods like okra. Okra has a number of benefits. It is one of our main sources of whole, like glutathione in our diet. And the slimy nature of what's inside of okra is what contributes to the mucus layer building. So we want to eat foods like that. There are many more that I teach about in some online courses and within the clinic as well. And I wanted to touch on obesity and insulin resistance and what it does to the brain. We found that insulin has two important functions in the brain. It controls food intake and regulation of cognitive function, particularly memory. So it's really important to have great insulin control and reduce insulin resistance, increasing insulin sensitivity. Also, excess weight has been shown to reduce blood flow to the brain, and this slower blood flow in the brain has been linked to cognitive decline and dementia and all the things. So obesity impacts brain volume. It shrinks the brain essentially. And this affects our executive function skills, our cognitive development, and can lead to a higher risk of dementia and Alzheimer's disease. So there are many studies that show these correlations, and so we just wanted to make sure that you guys knew the true science behind semaglutide and ultimately GLP-1 peptide, which is what it is. And so there are several ways that we can improve our GLP-1 peptide production by feeding Akkermansia with polyphenols, which is what makes colors in your food, your rich blues and reds and greens, and all of that is technically polyphenols. You can get it from herbal tea, you can get it from supplements, you can get it from a great diet. And so mucilaginous plants as well help us to feed this Akkermansia. Okra is one of those, but also marshmallow root and aloe vera that you can find in supplements like our gut sealer powder that we utilize. That helps a lot of gut conditions, but also apparently feeds this Akkermansia in a significant way. And ultimately is going to have impacts on improving gut lining integrity, which will reduce our inflammation, reduce our tendency towards autoimmunity, reduce our tendency towards neurological decline as we age. And so there are just so many benefits metabolically to knowing the science behind these things and then using that as fuel to be able to make sure that our brain is in phenomenal shape. And we do that through food and exercise and lifestyle It's pretty simple once we put it all together and understand these things and have the rich motivation to follow a good strategy. So here at the Deering Clinic, we show you how to do those things with a number of online educational tools, as well as in the clinic treating with short bouts of semaglutide, but ultimately working to get your metabolic function switched into high gear so that you can make it yourself and you don't have to pay for it and you don't have to deal with some of the side effects that do come with it, like gut motility issues and things like that, that really only happen when people are doing it in high doses to lose a lot of weight fast. That's not a great way to do semaglutide. And our medical team is well versed in how to prescribe semaglutide and how to titrate it up slowly so that you get the benefits throughout the body of reduced inflammation and weight loss and all of that without the side effects of irritating gut motility. So we would be happy to elaborate more on that. So just shoot us a message if you have any questions, and we're here to educate and to show you the way to good metabolic health and good brain integrity ultimately. So, all right, until next time, we'll see you later.